looks like you're good to go.
Awesome. Thank you. All right, I'm going to go ahead and call this Assembly Housing and Homelessness Committee meeting to order. We are noticed today, Wednesday, December 13th from 11 a.m. to 12:30 p.m. Thanks everyone for helping to make the pivot to virtual successful. We have a lot to go through today, so I'm going to ask folks, and we do have a lot of folks in this meeting right now. So I'm going to ask folks to please make sure that you stay muted until it's time for you to speak. And then I'm going to ask for assembly members who want to get into the queue to please just put yourself in the chat, and that will I'll make sure to go through that queue in the chat. Okay, so with that, we'll go ahead and get started. We don't have anyone signed up for initial audience participation, so I'm going to do my best to save time at the end of the meeting for final audience participation for anyone who wants to do that. We have a lot to get to today. So we're going to go ahead and start with the 2023-2024 Emergency Cold Weather Shelter Plan Implementation Update. We are going to start with the third-party oversight report. And before I continue, Member Broad, oh yeah, thank you. I think I know what you're speaking to. All right, so I'm going to go ahead and step back a second and do introductions. So I'm just going to go through the participants list and ask folks to just quickly unmute and say here or present. So I'll start with Member Brawley.
Here.
Member Bronga.
Here.
Member Martinez.
Present.
And then Member Salt. All right. I don't hear Member Salt, but I will just note he is in the participants list. And then, of course, Member Rivera, I am here. I think that's everyone. If I missed you, please just let me know. Okay. So then back to the agenda. So third-party oversight. So RRS, Restorative and Reentry Services, who at least one of them is just getting into the meeting now. Okay, great. I think both of them are here. They have been working as our third-party oversight for a few weeks at this point. And one of the first tasks that they accomplish according to their contract with the health department was that they would complete what they call a 360 assessment. So I wanted to give some time for RRS to walk through that report, to give us an update on their work, areas that they think are going very well with all of 3 of the ECWS locations, and then any areas for improvement that they have noted. So Travis, I know I just emailed it to you a couple minutes ago. Okay, perfect. I think that's the presentation that RRS sent us over. So I'll go ahead and turn it over to Kathleen and Monica.
Thank you very much. I just wanted to first express that Monica and I are very appreciative of this opportunity to do a third-party oversight. We have a few things to go over right now. I don't know if everyone has had the chance to read it, but just kind of a brief overview of that and then steps forward. And so the first thing is we went under contract on November 18th, I believe it was, and we started the 5-day oversight and completed it by November 22nd or 20, and then we wrote it on the 24th and submitted it to the health department. Basically, what we looked at was the operations themselves, the sorry, I'm trying to find a place to settle in here. I'm hold on just a second. Let me just get right here. Sorry. So basically we started just doing a 360, which means you look at the community perspective, the shelter operations themselves, the clients, and we have 11 groups of people that are shown in the report. We touched somebody in each one of those 11 groups. to get an idea of what was happening. The basic belief that we have is that all three are up and running, and all three have strengths and weaknesses, but that everything that we are identifying as a concern is a solvable concern so long as we all work together. In doing so, communication and collaboration is absolutely essential. And what I mean by that is RRS is going to report out very transparently the facts and the circumstances that we see for those around us to make whatever decisions they're going to make with regard to that. And so, with that open communication, we have set up through the health department a weekly meeting on Wednesday so that we, as well as the individuals that are the operators and the health department, can have a very drill down conversation about certain things. This afternoon, we have one at 2 o'clock, and I sent an email to everybody this morning identifying some of the challenging issues that we need to explore. I will not go in great detail about them only because I think it's fair for us as a group to talk about them and see which ones are resolvable and which aren't before making any more additional comments about them. We also are doing town hall meetings. We do 3 a week, one at each of the at locations. We have yesterday it was at the Alex. Tomorrow it's at the cold weather shelter, and on Friday it's at the Aviator. The goal of those is very simply to just build communication and transparency about the services that are being offered, to shine a light on things that could be improved, and to also applaud the things that are going well. We have also put up our flyers in each one of the locations so that people can call or text us directly if they are concerned about a particular issue. What we have seen so far in the past 3 weeks of oversight is that most of the concerns were basically I call them self-resolving, meaning that when a client had an issue, I was able to work with the floor staff at one of the locations to solve the problems. Oftentimes, the issues that people were concerned about were their stuff was not found. They didn't feel that the food was sufficient, the quantity was sufficient. They didn't have a good experience with their roommate and wanted to be moved. And those are self-resolvable. We also have others that are coming in now that are a little bit more significant that we will be dealing with Henning and the health department about, and then we'll do a report out in our weekly report. We also do a bi-weekly meeting with members of the assembly, the health department, and the mayor's administration. And once again, the goal is open communication. The bottom line, and I'll let Monica also talk about the views that that she has had with regard to this. We do have some challenges with regard to data because of confidentiality, but also aggregate data that we're mandated to report on. And that is going to be something that we are going to address with the Anchorage Health Department and the operators this afternoon at 2. But we do want people to appreciate that we are trying to make sure that aggregate information is provided to everyone in real time and in a timely way. With respect to that, we are also open to any conversations or communication that individual assembly members want or questions that you want to deal with. So we're very happy to do that as well. But I think, once again, like the Houston model works because there's a collaborative goal of serving the client. And if we can enhance and encourage collaborative goals of serving our clients, we can do some really great work together. And with that, I wanted to turn it over to Monica.
Thanks,
Monica,
Kathleen.
before you go, just want to note for the record that we've been joined by Mr. Cross, and then Mr. Soltz was also here at the meeting from the beginning. Go ahead, Monica.
Thank you. So RRS met with ICA, which is our the organization that does the AKHMIS data reports, and has been granted access to aggregate data from the emergency cold weather shelters. And we have done some data analysis of that, but we, before officially presenting it to the Housing and Homelessness Committee meeting, since we really just were granted access to that last evening, and the data analysis, I just did it this morning, we want to present it to the operator in the health department first this afternoon, and then we'll share it with you, Felix, and you can share it with whoever you want to share it with. But we're just starting to kind of look at trends about how people are moving through the system and what the demographics are of the clients. And all of this is being done in order to serve the clients better and to help people move through the pipeline faster into permanent housing. And I guess with that, I will turn it back to Kathleen.
So we are available for questions. If anybody wants any specific details, we are happy to respond to them at this time.
Thanks. So I believe I have Mr. Cross in the queue, then Member Barley, then myself. Go ahead, Member Cross.
I really appreciate it. No, thank you for the presentation. Thank you for the information. You know, the meeting that we had with the Houston delegation or group was extremely informative, and I like a lot of what came out of there. And I think it's important to point out, I did some additional research on Houston, and they have a 9.9, almost a 10% vacancy factor in their larger multifamily properties. So when you get over 6 units, and I think, unfortunately, that's not something that we have. Now, I'm not saying that their systems don't work and it won't work here. I think that they have really high numbers, and some of what they have is lofty just simply because the amount of vacant units they had in a private market where they were able to work with landlords was, well, if you look at ours at roughly 2.5, I mean, they're talking 5 times as many vacancies per capita than what we experience. And I think that's going to be a challenge we're going to have. I mean, I still think we need to move forward with some of these private partnerships and different agreements, but just we need to realize that our housing market's a little different, and that's going to create some different challenges as far as getting the private industry to be as receptive as we hope they would be. Thank you.
And can I respond to that? Just briefly, I totally agree with everything you just said. The point I think I want to make is that nationally, the goal right now is to address homelessness with a collaborative approach. And that is being shown in Washington, D.C., in Vermont, now in Seattle. And it is the collaborative approach that I think Houston really got spot on, which is making sure that our agencies, entities, operators, and government oversight will be able to work together so that we are not all riding in our separate lanes. We all have to be on the same freeway.
Great, thank you. Member Brawley?
Yeah, thank you. And thanks for your work. I have 2 questions. One, I know a member of the public asked it, so I'll go ahead and ask it. Just to confirm, are your weekly meetings with the operators open to the public, or is that a closed meeting?
So the weekly meetings, I think we would have to ask the Anchorage Health Department and Alexis Johnson about that. I would not mind if it was open to the public, but I think that because the contract is with the Anchorage Health Department, they are going to be the ones that are going to have to make that call.
Yeah, and just to be clear, I'm not advocating you do that, because I think there is, you know, there's plenty of business meetings that we all have that are not open to the public, but it seems like maybe having a regular opportunity for the public to participate with you guys is maybe the appropriate ask. And then my other question is, I'm just going to repeat a couple things I've heard from constituents or just others. Some concern about whether, are we still seeing full utilization of the beds? Knowing that maybe somebody says they're going to show up and they don't, there's always those issues, but kind of how is utilization at both congregate and non-congregate? And then the other issue that I've heard is concerns about people being removed. Again, there's different stories and probably has to do with individual behaviors in some cases, but if you can just comment kind of on, are we using all of our beds? And then have you seen kind of elevated issues with people not being able to stay there? Thanks.
I think those are two really key questions, and there are some concerns that have been raised to me with regard to both of those, and those will be addressed more specifically at the 2 p.m. meeting. What I can say is that there has been only one occasion where I was told that the cold weather shelter was at capacity, and that there has been, especially during the day, an opportunity to get individuals into the cold weather shelter without any kind of challenge that they are at capacity. There will always be, because there is movement in this population, some beds that are open for a minute. But I do believe that with this respect to the hotels, there is a very proactive um, mood to make sure that those are filled as greatly as possible and as quickly as possible. And one of the things, just to add to that, is that the operators are doing, which I am totally a fan of, and that is to use the shelter beds at the hotels for those that are capable and needing them, and being able to be stabilized in them. And so there's been movement between the hotels and the cold weather shelter in order to accommodate people based on their capacity and need. As to your second question about the exit and entry into programs, that is something, again, we're going to talk about at 2:00 today, because there have been some concerns raised to me with regard to that. And we need to talk to the operators and the Department of Health directly before I'm going to be able to make a statement on behalf of third-party oversight. But that is something we are looking into.
Great. Thanks. So I am next in the queue. So just before I ask the question I had, just a couple things. One is just a reminder to members, we do have a few other items under the implementation update, including the budget needs, data reports, and outcomes. And so I think some of the things that folks are asking maybe will be addressed in some of those other issues. But specifically to RRS, are there any areas of improvement that you have highlighted for ECWS?
We have made requests and statements of improvement, and there will be more coming. One of the things that we owe to the Department of Health is a report for the first 2 weeks, and that will include some recognitions to address challenges and view them as opportunities for change. So yes.
Thanks. Are there any specific ones that you want to highlight at this point?
I think one of the concerns that we are attempting to address, and we will be addressing tonight, are the exits and entrances at CWS, and especially those that are happening in the evening and overnight times. Because one of the challenges is, because of its location, people, if they are exited because of bad behavior, where do they go? And that is an issue that seems to be coming more immediate in the last week. Because if people don't have a place to go and they're cold, they may make choices that are not healthy for the neighborhood. So that is one of the things we'll be addressing this afternoon.
Got it. Thank you. Member Branga?
Thank you. I saw on the 360 report that the Alex doesn't have a curfew. And I was wondering if the Aviator is the same, and if there's a possibility that, I mean, people have to work in those certain hours. I understand it, but I wondered if you're exploring a curfew.
The answer to that is yes. We recommended a curfew about 8 days ago, and it was implemented on December 1st. I'm sorry, it was implemented on December 1st, so we must have asked about it 12 days ago. So there is now a curfew at the Alex.
All right. Thank you. All right. So then I'll go ahead and move us on. Thank you, Kathleen and Monica, for the report. I'll go ahead and move us on to the 2024 budget need. So if the Anchorage Health Department can speak to the status of the ECWS budget, where we are right now on spend, how much we have left in the bank, and do we have any idea of the total budget need for January through April?
Yes. Can you guys hear me okay?
Yeah, we can.
Wonderful. Is there any way that I can share my screen? It looks like I don't really have option right now.
Give me 1 second. I should be able to make you available to present.
Perfect. Thank you, Travis. Can you guys see my screen okay?
Yes.
Perfect. So I'm just going to go through this slide deck. We'll talk about data reports, outcomes, and then the 2024 budget need, and we'll go from there. So today we're going to talk about cold weather shelter location, the Aviator Hotel, the Alex Hotel. As Kathleen mentioned, getting into shelter via ASP, an update with that, and then our budget for 2024. So to give a short brief on cold weather shelter, we have renamed the shelter officially from SWS to CWS. It's essentially translated to cold weather shelter. So the community wants to step away from the solid waste services narrative and go into CWS. So as CWS started, we opened on October 31st. So during the month of November, we had 7 exits to housing, and 50 people have exited through CWS into non-congregate. One of the questions we get is how many people are permanently banned or trespassed, and that is 9 individuals, and that's not CWS specific. It is emergency cold weather shelter specific. So 9 individuals are not able to access any of the 3 locations. Currently at the Aviator, we have 274 non-congregate beds. During the month of October, so the first 2 weeks, we had 4 exits to housing. November, we had 6 exits to housing. And then in December, as of last Friday, we've had 2 so far. We have had some room damages that were reported to AHD. We're a little bit behind on receiving those invoices, but for the first 2 weeks, we had about $1,000 in damages. Most of those damages were soiled bed sheets or smoke detectors being pulled off the wall, a couple broken microwaves, nothing too crazy for the first 2 weeks. We have had a significant number of discharges out of the Aviator Hotel, 124 so far as of December 8th. This discharge doesn't mean that they were breaking the rules, so to speak. It could, but it also means abandoned room. So if they left their room and they did not return within 48 hours, that room was turned over to someone else and they were discharged out of that room. The Alex is going really well. It's probably going the best of the 3 locations. We have not had any significant problems there. That's 100 non-congregate beds. And in October, we had 6 exits to housing. November, we had 7 exits to housing. None so far in December, but we are working towards getting a few exited from that facility. I don't know why it says congregate to non-congregate, but we had 50 people exited at the CWS location, so I'll edit that. As you know, Alex will be part of the Next Step initiative. So our plan is to exit all 100 people out of this hotel and into housing, plus an additional 50 people by the end of April. So what's going well at shelter right now? We have clients getting documents. We have a really good partnership with Rural Cap, CSS, and Henning, and we are all working collaboratively to get documentation. This includes 14 people getting IDs at the Alex within the last week, working to get people documents for their birth certificates so that it's easier for them when they are ready to move into permanent housing or independent housing. They have all the documents that they need to succeed. We have had 30 exits to housing in 45 days, and we have been working with the Department of Labor to have clients go to job fairs. That's been going really well so far. As Kathleen mentioned initially, we were having some trouble with contractors providing the necessary portions and meeting the USDA guidelines. We have remedied that, and it's been going well so far. The only complaint is the size of the portion. But it is meeting USDA standards. So it's a personal complaint that we're trying to alleviate. There is additional food on site, and we have had help with the food bank and private donations for additional dry goods on site. What is not going well? Currently, we've had discharges. What qualifies a discharge, aside from leaving your room, or abandoning your room, I should say, we have had, there's 13 minor infractions that we consider breaking house rules. In order to get automatically discharged, you have to break the same rule 3 times. So it's not a mixture of the 13 infractions 3 times, it's 3 of the same infractions, which catches you a 30-day ban. Outside of that, an automatic ban is for smoking in your room, drinking in your room, theft, or domestic violence, fighting, assault, any of those, sneaking people after hours into your room, etc. I will tell you that we have had some issues with drug use, and it's mostly occurring at CWS and the Aviator. We have had an unprecedented number of people experiencing overdose, and just to put on record, we do have current vacancies for substance misuse treatment beds that we're actively trying to get people into. And there is Narcan on site and readily available at all 3 locations. So to get down to the finances, currently we have all these contracts, and then the max contract amount. I'll send this out in an email to all assembly members so you guys can see, but our estimated actuals, when we go back to our balance, what we think we're going to have at the end of the year, we estimate about $771,000 remaining out of all the contracts. Again, these are estimates. This is based on how much they have billed us thus far, divided by how many days we've gone thus far, but we still have 2 more weeks to go, and still some outstanding invoices. So this is a rough estimate. We believe we will have about $771,000 remaining. This does not go back into fund balance. It rolls over through the Emergency Cold Weather Shelter Fund. And so it will be available for next year. With that being said, moving forward, the budget need for 2024, we estimate that we're going to need about $4 million, $3.8 million for getting us through April. This does not include October through December of next year. Currently under the administration and the assembly budget that was approved, passed and approved, $2.2 million was put forward for these efforts. And we think we'll have about, $771,000 to $800,000 remaining, which leaves us with a deficit of about $3.8 million moving forward. Is there any questions thus far? I can keep going.
I do have a few, but please keep going.
Okay, I think this is my last slide. So another update is for ATAX contracts that we have for 2023. These are not including emergency cold weather shelter, but they do include the early education and prevention, the substance misuse, and homelessness buckets. We think we'll have about $2 million lapsing at the end of 2023. This funding is essentially unspent ATAX funding that they couldn't invoice under those contracts. So we think we'll have about $2 million lapsing into the fund balance. Currently, we believe there's a fund balance of about $9 million. And then we have two initiatives that will be coming forward. We're working on those now, but I do want to just put them on record. One will be for summer campsite mitigation. This will include porta potties, hand washing stations, dumpsters, outreach, healthy spaces, overtime, possibly APD or security, outreach items. So we're working with Parks and Rec and APD to get that put forward before the body. And then, as you know, the administration has signed on to the Next Step initiative, which is our goal to get 150 people out of emergency cold weather shelter and into housing. The plan is to continue those efforts through summer and into camp. So we will be abating camps to housing. And so I don't know if there will be initial or additional funding needed, but we are working on that plan with the coalition right now. And that concludes my presentation today. If anyone has any questions, feel free to let me know.
Great, thanks. So a few folks in the queue. We'll start with Member Bronga.
Thanks, Alexis. I think this may be a very basic question, but I got to wondering why that food budget, why are we not using food stamps or SNAP benefits that if they have no housing, they probably would qualify for that? So that's the first one. The next question was, I got a message from somebody who had been in one of the hotels and was imprisoned. Is that, they can't come back? Is that true? Because it sounds like she lost her spot. And then the final thing is the summer camping got my hackles up. If we're going to put money in to mitigate summer camping, I'm hoping that we are thinking about a process to make it orderly in certain spaces, not sprawling throughout the city. And that's it.
Yeah, so your first question in regard to food, we have our housing navigators who work well with case managers to get clients who do qualify for food stamps to get on that program. That's something that we're consistently doing all the time. That's not something that's offered in lieu of meal service. We provide 3 meals a day at all emergency cold weather shelter sites, regardless of if someone is on food stamps or not. Secondly, your question about jail. If somebody has committed a crime on site, like an assault that ends in their arrest, they will be automatically discharged from that site. If somebody was arrested for something else and they were held for about 24 hours, there's usually a communication, especially with RRS, to the shelter site to say, hey, this person is being discharged from ACC, and can we make accommodations for that? That also includes ASP. And so we have a great communication on that. But if someone is arrested for more than 24 hours, they will automatically lose that unless it's communicated to shelter staff prior. But most likely they will lose their spot if they are if they're in jail. And then I forgot to go back. I want to talk about this really quick. You guys can still see my screen, correct? Perfect. So Kathleen had mentioned this, and this is something we're working through right now. But ASP will discharge people who are no longer Title 47 at sometimes odd hours of the night. So we have seen that ASP will discharge, and they will provide a courtesy ride to a person, and sometimes the person who is being discharged is a client of CWS. We do have curfews at that facility. It's 10 o'clock, but we will accept anyone being discharged up until about midnight. the issue becomes if they are discharged in the middle of the night, 1 or 2, 3 a.m., where do they go with their courtesy ride? Because they're not allowed into CWS after midnight. We also can't hold someone who's no longer Title 47 at ASP. Because it would be like false imprisonment. So we're trying to work through these challenges right now, but I do want to alert to that because we have seen some neighboring impacts of ASP courtesy dropping people off near the shelter at 1, 2 a.m. and they're just hanging out in the neighborhoods causing some trouble sometimes. And so we are working through that, but if that's something that the community reaches out and says, hey, this is occurring, this may be one of the reasons why. So we are working to alleviate that.
All right. Thank you. Member Brawley?
Yeah, thank you for the information. I just have one question. So regarding the rules for when you get banned or discharged or trespassed, I understand that there's safety issues and so on. I guess I'm surprised to see that smoking or drinking or drug use is an automatic ban. I again understand the public safety implications for that, but given that especially if you're wanting folks to be in treatment, it's hard when they're automatically out on the street. So I just wonder if you could speak to the rationale for that, and then I just wanted to flag that as something to consider, maybe not treating as an automatic ban going forward.
Yeah, so low barrier shelter essentially means that you can come in under the influence of drugs or alcohol, but there's no active smoking or drinking or drug use on site. We've had some issues with roommates where one wants to engage in, smoking an illicit drug. And so the other roommate will come forward and say, hey, I'm trying to get sober. I'm trying to be clean. I've been clean for X amount of times. And then they have somebody who is smoking something on site. So as far as like the hotel or the Alex or the Aviator, it's been an automatic ban for people who are actively engaging in drug use or drinking or smoking on site. And I believe it's a permanent ban for that.
Yeah, thanks for that. And I understand the rationale. And of course, living with roommates, it's not just about that person. I just, again, want to flag the, maybe there's a conversation to have about at least one warning, or maybe it's different by substance, but I don't want to put us in a situation where, we're just charging folks immediately because of something that, anyway, I just wanted to flag that.
Thanks. Dean, did you want to speak to this point?
Yes, thank you, Felix. I just wanted to ask if the bans and some of those house rules, is there a difference or distinction between whether it's that private property operator like the Aviator versus our cold weather shelter on 56th?
Dean, I can get back to you on that. I'm not sure if the trespass is on the private property or if it's different for CWS. I just know that these infractions are blanket citywide and they've been adopted at all 3 of the sites. So I will find out.
Yeah, thank you.
Great, thanks. So I have myself next in the queue. Just a few things. One, Alexis, if you could please email me these slides so that I can get them up on the committee website.
Absolutely.
And then I had a question on the budget. Could you go to the next slide, please?
Yeah.
All right. So could you just remind me, you had said for January through April, you're projecting a 4-point-something million budget needed. Can you remind me what that number was?
Yeah, we believe it's 3.8 million because Christian Health Associates is already funded. The RRS is already funded. Covenant House, I believe, is already funded. Trying to recall. We have 2.2 million appropriated already. And then that 771 remaining fund balance. So 3.8 we believe is going to be needed. That's a low estimate because these numbers that I put forward right now that you're looking at are high. I mean, that's $100 a day per person at all shelter sites.
Sure.
We haven't been, I mean, that's a high end of a budget, but we believe we'll be about 3.8 million in usage.
So just to make sure I'm understanding what you're saying, so is this 3.8 million needed on top of the 2.2 million and on top of the 800,000?
Yes, yes, it is.
Okay. And then third question I have is on so really great that the ECWS locations are really housing focused and that we've transitioned 30 folks out of ECWS into permanent housing. It might be a little bit, you probably don't have this information now, but as the months go on, you should be able to track information on how folks are staying stably housed, which is really the key component to measuring success in the work. So I'm wondering if that is something that either the health department, RS, or the operators are tracking through AKHMIS's the housing stability for folks.
Yes, I wonder if Cesar is on, but Cesar is running all the data for the emergency cold weather shelter system. And so we have been working on stably housed and people who are remaining in housing. So I will get you that data as well.
Okay, perfect. Yeah, I think that's something, I think it's good to report how many folks are transitioning into permanent housing, but I think it's also equally important for us to report how many folks are stably housed. So we get a sense of what the churn might be. And hopefully there isn't any churn, right? Hopefully folks are staying in housing and not going back into shelter. All right, that's it from me. I'll go ahead and move it on to Member Salt.
Thank you. So, Ms. Johnson, I have a question. I had heard anecdotally that residents at the Golden Lion were leaving to go to the cold weather shelters. I'm curious if that is true, or if it is, then is it a significant issue, or is it just one or two cases that you're aware of? Thanks.
Yeah. So initially when emergency cold weather shelter had opened up, we did have some people come forward to Henning staff and say, hey, I'd like to terminate my lease. They were self-payees, meaning that they were using their own funds for that. The thing is that Henning is running the Golden Lion, and so they know who those people are. And they're also running emergency cold weather shelter. And so they've advocated saying, hey, emergency cold weather shelter, is only through April. You don't want to lose your spot in the Golden Lion, because come April, if the Golden Lion is full, you won't be able to access, that type of housing anymore. So Henning has really advocated to not do that. I believe we had 2 or 3 people that did that. Anecdotally, and I can pull this up, is we received information from AAHLT that they were having some issues with people not wanting to leave emergency cold weather shelter into housing because the additional cost to live in that facility. And so that was a complex challenge that we're actively trying to work on, but we just continue to communicate to clients that, emergency cold weather shelter is not forever. And come April, there's only limited available housing within our city right now, and you should get in as soon as possible, because that housing may not be available when the cold weather shelter closes. So we have heard it from the Golden Lion, and we have heard it from AAHLT.
Thank you. I think that's a good approach, and I think it just highlights the need to help people moving from cold weather shelter to somewhere like the Golden Lion with some sort of rent assistance, or help them, successfully graduate into that program. Thank you.
Mm-hmm.
Great, thank you. All right, I don't see anyone else in the queue. Thanks for that presentation, Alexis. All right, I'm going to go ahead and move us on to the transition out of emergency cold weather shelter. We have a few other items on our agenda, so I think we'll have to move a little bit more quickly through these other things. So I just wanted to bring up one item today for discussion. Just as a reminder, we do have a few different lanes in terms of the transition out of emergency cold weather shelter. We have the next step, which is housing 150 individuals by April. We have the pilot shelter pilot program, which is, I think that's 30, 40 individuals. And we have a work session on both of those things on Friday. So if folks have questions, I'd be prepared for that on Friday. And then we also have the AAHLT, the Anchorage Affordable Housing and Land Trust, vacant and abandoned properties appropriation that we did some months ago. And so that's about 30 to 40 additional units there. So we do have a hodgepodge of units here and there that I think will be helping out with the transition out of emergency cold weather shelter. But I do think we still have a little bit of a delta. And so I wanted to spend some time today focusing on one piece of that puzzle that the administration has talked about. And that's specifically around continuing usage of the CWS past April. So I just wanted to gauge the administration and members on continuing to use CWS as shelter. So first, I just want to hear from the administration, health department. Is this still something that the health department supports? Is usage of CWS past April? And then do you have any idea on costs? So if you can just lay out where you are coming from with that, and then happy to hear thoughts on my colleagues. And my hope is that well before April, we have come to a final decision point on CWS so that we can give that assurance to folks. So I'll turn it to you, Alexis.
I am so sorry, Felix. I was just called away. Can you ask me that question one more time?
Yeah, so specifically, I just wanted to ask you about CWS and
Okay.
continuing usage of CWS through the summer. So is that something that the administration and the health department still support? And then do you have an idea on costs?
Yeah, so this is something that I brought up during Next Step Initiative. Originally, we were talking about having 150 people throughout the summer for like essentially shelter for the highest needs. One thing that Houston had mentioned when they came to Alaska was that they do have a navigation center, and essentially what it is it's a shelter that people who are in a holding pattern for housing can access that type of facility for no more than 30 days. And it's essentially, we're abating you out of a camp, but we have this place for you to go while we compile all your documents and help you get case management and wraparound services. And so I think where we currently stand would be, we're interested in exploring that idea at CWS to have a facility where people are moving throughout that system and not consistently just remaining in shelter, but leaving, unsheltered homelessness, being held in a holding pattern for up to 30 days at CWS, and then moving out to independent housing. So I think that's an idea that we could explore and kind of shift our focus towards that type of shelter.
Okay, yeah, thanks for that. I guess just an initial question from me, and then I think some other folks are getting into the queue. So does that mean that essentially it's not going to be a walk-in facility anymore? Nor will it be 150 beds unless there's like a 150 person camp that you're abating, right? But essentially it's going to be, you abate a 30 person camp, and those who are interested in housing will move to CWS, go through the process, stay hopefully less than 30 days, and then they'll move into housing. Is that essentially what you're imagining?
Yeah, I think this is an idea that we should possibly explore. I don't want to completely abandon the idea of continuing a shelter for the highly vulnerable throughout the summer. If that's a higher need than what we're seeing as far as like Next Step Initiative, we're definitely amenable to that. But I think it is an idea we should explore because we do know that when housing comes on sporadically, especially when we don't have very much housing within the city, there is going to be a lag in time between getting people out of a camp into a housing unit that matches their needs, plus wraparound services, making sure they're signed up for all the social programs that they qualify for. So I think moving towards that type of facility would be beneficial.
Got it. Okay, thanks. Member Salt?
Thank you. I personally, I think you asked for feedback. I like the idea of solid waste services, you have the shop floor that could potentially be some allowed camping. It has space for a pallet shelter type community. So I think it could be multiple outreach options. But I guess I do know the administration or solid waste services wants that facility back and has plans for it. So I was just curious if you knew what those plans were and what their timeline is that they'll need that facility back.
Thanks, Randy. So as of now, we have been told by SWS that they would like it back at the end of a 2-year term to restore it back to like a recyclable, renewable incubator project. That being said, I don't know if the administration has any ideas for it in the near term, but the last discussion that we have had is that we would have hopes that this would remain with shelter through the next 2 years until SWS needs it back.
Okay, thank you.
Great, thanks. All right, so then I guess this would be a great time if members have any thoughts on this idea to share with the administration, or any other ideas that you may have with regard to usage of that particular facility as a transition out of ECWS. So first I have Member Brawley.
Yeah, thank you. And in general, the way I look at all of this is how do we balance the real need in our community and the cost of not doing anything or not doing enough with, the reality that we have finite resources, right? So I'll just say, I'm really interested in figuring that out. I'm open to using that facility for, longer than April. I also hear that the solid waste services has plans for that, and it's obviously their facility, so I think we can't do that forever. It does underscore the need to really think long term and figure out, what shelter do we need for who, how many people, all that stuff. So I think this is a good opportunity to kind of test out at least what this shelter has looked like. It's smaller. It's not the mass shelter that we had at the Sullivan, for example. So I think I'm encouraged that we figured it out now. I'm thinking hard about where we're going to find the resources, and I guess to the administration, I appreciate the willingness to work on this. And I think to the point about next summer, it is just a reality that when we have a lot of folks who don't have housing and can't afford housing, they have to go somewhere. And so I'm just really interested in how we maintain folks' dignity as much as possible, and help people succeed long term, which sometimes means helping them for longer than maybe some people would want, but that's the reality. So that's my thoughts right now.
Great, thank you. Member Branga?
I also support that exploring keeping this open, and I like the idea that it's a transitional place that people are moving through, and then once again hoping that we make a very strong plan for those who are not going in the shelter, that are not being housed, because if you start out with expectations, it's going to be much better than the Third Avenue Cuddy experience.
Great, thank you. All right, I don't see any other members in the queue. I guess, Ms. Johnson, question for you. When do you think, I understand that you're working with Next Step on all of these ideas and with the system, which I appreciate your coordination with the system on this. When do you think that the system, including the Anchorage Health Department, will be able to present on this idea? Do you think this is like a February, March thing?
Yeah, I think we'd like to present early February. That way we at least have a couple meetings prior to first quarter budget revisions. I know that we have an alcohol tax fund balance, so we could put an appropriation forward, but I'd like to come correct with summer mitigation, next step initiative ask, and then as well as continued use of the CWS building. I can provide both pro formas for 150 person shelter with food, or the housing exit plan with or without food at that point. So I can bring all 5 of those early February, I would say.
Great. Then I'll look forward to that discussion then. Member Branga?
I also wanted to put out there that Pastor Andy from First United or St. John's United Methodist, and a parishioner from Central Lutheran have formed a nonprofit called In Our Backyard. And they are really, really wanting to start pallets at various church parking. So if we can in some way work to make that a possibility, I think that could be a big help for our people experiencing homelessness to have another option.
Great, thank you. Okay, not seeing anyone else, then I'm going to go ahead and move us on to a report from Catholic Social Services. So CSS wanted an opportunity to give us a report on how things are going at their three facilities, their main facilities, the Navigation Center, BFS, and Complex Care. So I'll go ahead and turn it over to CSS for their presentation.
Great, thanks, Felix. This is Robin Dempsey with Catholic Social Services. I just really wanted to say thank you off the bat for just giving us an opportunity to present to the committee today. We're really excited to share some of the work that we're doing in our homeless sector. I'm not sure how we're queuing up the PowerPoint. Do we know, Dave?
Travis, if you can go ahead and share the PowerPoint.
Sure, we'll do.
Great. And if you're in control, Travis, if you could just hit the next slide. Great, thank you. So I just wanted to kind of do a quick overview of the homeless programming that we have at Catholic Social Services. So we have adult services, and that really includes Brother Francis Shelter, Complex Care, and then our Third Avenue Resource and Navigation Center. And those will be the three programs that we'll be presenting on today. I just wanted to mention also that we have family services. So we have Clare House, which is our shelter for women with children and expectant moms. Homeless Family Services, which is at this point a bit of a misnomer. That's really our housing case management service, and that is for anyone experiencing homelessness, whether you're a single adult or family member. And then we have Supportive Family Services, which is a program that we've been, it's fairly new to us, but we're working on 2-generational work, really trying to think about stopping the cycle of generational poverty and homelessness. So right off the bat, really just want to thank the Assembly and Municipality for your partnership. Our private-public partnerships are really so important to the success of the services that we provide in our continuum of care, and we're just really, really grateful for the support. I'm going to turn this over, though, to David Rittenberg. He's our Senior Director of Homeless Services, and he oversees the three programs that we're going to be talking about today. So I'm just going to kick it over to Dave.
Yeah, thank you, Robin. And again, thanks to the Assembly for your partnership. As Robin said, the public-private partnership is just essential for making these services successful. So I'm going to go relatively quickly through the presentation because I know we're a little bit pressed for time. I want to leave some time for questions. So if we want to pop over to the next slide, please. So Complex Care, as some of you may know, opened up in June of 2022. And since opening, we've served 351 unique individuals. It is located at the corner of Fireweed and C Street. And it is a shelter for people that are experiencing complex medical conditions or might have some access challenges to where they do not do well in congregate shelter. So it's 83 beds of non-congregate shelter. Most people are in singles or doubles. And it's going to have a lot of the similar services that you would see at a emergency shelter: meals, laundry, case management, those types of things, but with a specialized focus on expertise for getting people connected to things like Medicare, Medicaid, healthcare, home, Social Security, you know, those things that people that may not be moving towards employment, but might be moving towards, you know, some sort of benefits or something to support them long term. We can go over to the next slide. So complex care started as part of the facilitated process of moving towards multiple smaller programs to better fit people specific subpopulations, and people with complex medical conditions is one of those. So again, really having a specialized place where people can get access and help accessing benefits and healthcare, those types of things. And recently, we have started our 1115 Medicaid waiver services at Complex Care this past summer. So we're starting to have some billable services there, which is really exciting for the future of the program. We can go over to the next slide. And then, so just a little bit about the data about complex care. Since opening, this is as of December 1st, provided over 40,000 bed nights, over 100,000 meals, close to 1,500 transportation services, and those are either going to be taxi vouchers, rides from a case manager, or rides in our shuttle, to a medical appointment or a housing appointment. Our average length of stay is about 119 days. Case management, we have a number of case managers there. Case management is not required of clients at Complex Care, but we take the stance of engaging with people. And last quarter, we had 91% of our clients that had a case plan. And since opening, we have moved, or we've helped 80 individuals move into housing. And so that's, going to be some sort of housing situation, whether it's reconnecting them with family or friends, or moving into independent housing. There is a small percentage of people that have, we still consider a positive discharge, but doesn't necessarily count as housing, whereas they've got moved to like a higher level of care, and that could be assisted living or that type of thing. And then also, one of the things that we really wanted to focus on moving into a new neighborhood was maintaining good positive relationships with the neighbors. We have an official good neighbor agreement with the North Star Community Council. And we conduct neighborhood rounds in the area, going up Fireweed and going up and down C Street, trying to help solve any issues and just make sure that everybody is safe in the neighborhood. We also offer our expertise to the neighbors. One example that I go to is there's a laundromat next door, and if I have a stain on my shirt, I'm going to go to the experts and they can help me with that. And if they have somebody that's experiencing homelessness, that they are having difficulty addressing those issues, they're going to come to the experts. We have the ability to, make those referrals and get someone connected to an appropriate service, whether it's another shelter, or Anchorage Safety Patrol, or that type of thing. So really, from the get-go, making sure that we have good, positive relationships with the neighbors. So we can go to the next slide. So Brother Francis Shelter, it's been open for about 40 years. We just celebrated our 40th birthday this past summer. Low barrier shelter for adults experiencing homelessness in Anchorage. In the past year, we have served 868 unique individuals, providing a little over 42,000 bed nights. We have recently moved, or in the past year, moved from our 240 bed model to our pandemic posture, and then have reworked to 120 beds currently, permanent beds, 24-hour services, and has really improved the experience of individuals staying at Brother Francis Shelter, and also the neighborhood as well. So we can go to the next slide. So, providing easy access to high quality services is really what we're trying to do at Brother Francis Shelter, and get people moved towards permanent stability. Part of someone moving towards permanent stability is, trying to have some sort of launch pad or solid foundation to make that step from. And so, we're really proud of being able to provide that and have the guest experience at Brother Francis be positive. We have 96% of our guests report that they're being treated with dignity and respect by staff. 91% report they're feeling safe and secure at BFS, and 78% reporting that the sleep at BFS is average, good, or excellent. So, there's some numbers that we're pretty proud of, and I think really speaks to the importance of providing that solid foundation, that feeling of security and that feeling of safety, so someone can try to take those next steps, whatever those might be, for that individual. If you want to go to the next slide, please. And so, again, talking about moving people through Brother Francis shelters. And so in the past year, so from November through October, 68 guests have been housed. 38 have been rehoused in Anchorage, and then 30 have been relocated and connected with family and friends. And so, we make sure that if we are working on relocation with somebody, that they have a stable place to go to. We get somebody on the phone and make sure that they have somewhere that they can land. These numbers only capture individuals that have been housed by CSS or Homeless Family Services programs. So it does not necessarily capture people that have self-resolved or have been housed by other organizations. That is something that in the coming year we're trying to get better at counting. And when somebody leaves Brother Francis Shelter, they don't always tell us where they're going. So the 68 are people that were housed directly by CSS Case Management Services. Another very important part of BFS is some of the medical services that we're able to provide there through partnerships. We have a clinic that's operated by South Central Foundation that is open to guests of Brother Francis Shelter, but it's also open to individuals that may not be staying there. We average 123 clinic visits per month so far in this calendar year. We're on pace to have more visits this year than we did in calendar year 22. And then we also have a medical respite program in the back for people being discharged from the hospital where they need a little bit of rest and recuperation before they can get back on their feet. And that's different from complex care, and that complex care is more of a chronic condition that someone needs to learn to manage and get services to manage long term, whereas medical respite is more of an acute type thing. Where they just need, a week, 2 weeks, up to 60 days to be able to heal. We also have our case management services there and employment resources. We have in the picture here, we have Lawson, one of our evening leads, and then Ron, who was staying at Brother Francis Shelter, got connected to the MAST program, and he's coming back to Brother Francis Shelter to help serve the meals, but is doing that through the Mature Alaska Seeking Skills and Training program. So he's actually getting paid for that work now too. And so we recently got a grant from the state, a STEP grant, to really build up our employment services. So we're really excited about that. Another important part of Brother Francis Shelter and really the campus at large is maintaining good neighborhood relations. And we also have a agreement with the Fairview Community Council, Good Neighbor Agreement, that encompasses not just Brother Francis, but the entire Third Avenue campus, which includes the Third Avenue Resource Navigation Center, which I will be talking about next on the next slide. So really exciting over the past 10, 11 months or so is really moving towards a coordinated campus. We have, the same organization operating Brother Francis Shelter and the Third Avenue Resource and Navigation Center. We're able to cross-train, trade staff, manage the property together. The Third Avenue Resource and Navigation Center opened up this past February, and we have been pretty busy. We've served 3,174 unique individuals, and that's over 18,000 front door entries. So 3,000, a little over 3,000 people came, a little over 18,000 times. So we can go to the next slide. And so this individual we have here, I think really is a great story for 3RNC. You know, she came in. We have a quote from her where you know, she was able to come in, get a couple noodles and a cup of coffee. She was able to meet with legal aid to get help with food stamps. She was able to get help with her Medicaid. A navigator helped her to fill out an application for her apartment. She received more housing information, met with Cook Inlet Housing. She received a free phone from FREMO, the Federal Connectivity Program, worked with 9 Star and ARC of Anchorage. All in one location, which is really what we're trying to do here, is be a one-stop shop for people to access multiple services. So through the summer, we're averaging about 100 to 120 clients per day. We have seen a slight decrease since there's been less foot traffic. We are operating our shuttle to go pick people up at solid waste services and the other locations so they can get access to services and then bring them back. We've done almost 5,000 showers since we've been open. We've leased out a little bit over 1,000 computers, so people will lease out a computer, be able to use it in the space. And then contributing to our community data, we've done 278 coordinated entry assessments and updates at the resource center. Of the 3,000 some odd individuals that have come into 3RNC, 46% of them have met with a navigator, which is really important because the navigators are people that are going to help get people connected to the different partners or different services that are either coming into the center to provide services or providing services elsewhere. We have also seen that of that 46% of people that are meeting with a navigator, 70% of them have reported experiencing homelessness, and 56% of that 70 have reported unsheltered homelessness. So we're serving a large proportion of people who are experiencing homelessness, but we're also providing some prevention services as well. We provide rental assistance through our BHAP funds. And we're also seeing people that might be on the fringe or might be struggling a little bit come in and get connected to services. So providing some of those prevention services as well, I think is an very important piece of the puzzle. The top 3 services requested of navigators: 1 is help with housing, 2 help with transportation, and then 3 getting connected to a shelter bed. We can pop over to the next slide. And so, another really important piece of the puzzle here at 3RNC are our partners. The space is really, the partners are really what bring value into the space, having a wide array, wide menu of different services that somebody can get. So we've had 47 partners provide 726 different partner events since we opened. A little bit under 1,500 individuals have met with a partner. Where we're seeing that clients on average that meet with a partner meet with a little bit over, I think it was about 2.2 partners. And so people are able to meet with multiple partners in one location. Our most popular partners have been the Affordable Connectivity Program, so getting a cell phone. The Food Bank of Alaska has really done amazing work with getting people connected to SNAP benefits, those types of things. And then Partners for Progress has also, a reentry program that has been very popular down here. So that we can go to the next slide. So that just want to thank you for giving us an opportunity to present to you all. If there's any partners on that are interested in providing services or working with us down at 3RNC, please reach out to me. With that, I'd open it up to questions.
Great. Thank you so much for that presentation on all the great things that CSS does. I'll go ahead and open up to the queue to see if folks have questions. We are a little bit time limited, but if folks have questions, now is the time. Go ahead, Member Branca.
So it seemed like a pretty small number that got housed. I think you said 38 other than some were sent maybe out of state for a whole year. And I wondered if there's some way that we can help with that. And the other thing, I wanted to get this on the record. This has nothing to do with you, but since you have a navigation center, we got to figure out what we're going to do with the mayor's tent. And we shouldn't be still paying for it. We have a navigation center. But any comments on the kind of low number of getting housed?
Yeah, so the way that case management has really been working at Brother Francis Shelter is we're pulling people off of coordinated entry. So our case managers are primarily pulling folks off of that list, and so the case managers at BFS are not necessarily dedicated to clients staying at Brother Francis. They're really serving the entire community, and so when someone comes up on coordinated entry, maybe they're staying at Brother Francis Shelter, or maybe they're staying elsewhere. And so that's really sort of what they're where they're pulling their clients from. And so those would be the individuals that came up on coordinated entry that were also staying at Brother Francis Shelter. One of the things we need to get better at counting are people who have self-resolved or people who have been served by other organizations. I know last week or the week before, Graceful Touch was down here working with someone that had an AHFC voucher, and we're moving them into housing that day. That's a data point that someone that was housed out of Brother Francis Shelter, but they weren't necessarily housed by Catholic Social Services. And so that's something as a program we need to get better at counting. I think one of the important roles that BFS serves is in shelters in general is that when someone comes up on coordinated entry and we're looking for them, if they're BFS, we're able to find them. If someone is out camping, they can be much more difficult to find because people are moving around. We may not know where they are, but when someone's number comes up on coordinated entry and they're staying in shelter, or they have a data point at 3RNC, these make it easier to find people.
Thanks.
Great. Thanks so much. I don't see anyone else in the queue. What I'll do is I'll just encourage members, if you haven't had a chance to go out to the Navigation Center or take a tour of BFS, since it's changed pretty drastically, I would encourage folks to reach out and do that. Okay, well, thank you so much, David, for the presentation. I'm going to go ahead and move us on. We have a few additional topics to cover. I am going to cover a couple of topics that are just report outs, and then I'll go back to the 2024 committee agenda topics, and then the introduction to the coordinated funding discussion, and then we'll end with any final audience participation. We might have to extend the meeting just a little bit to squeeze all of that in. So getting to it, the Housing Summit Outcomes and Strategic Plan Review. So we had a great work session on the Housing Action Plan. So we're actually, I didn't update it in the agenda because it was too late, but we're actually removing the word strategic from that. So it's not a super long title. It's just the Housing Action Plan, very succinct. Since we are a bit low on time, the only thing I'm going to mention here is that probably starting in January, you're going to see topics in this agenda section, which speak to the specific strategies or actions outlined in the plan once we actually approve the plan next week, so that we can get to work on housing in this committee in a very targeted fashion. So something I'm very excited about. With regard to the legislative and budget priorities, I'm going to be brainstorming ideas for updates to the Assembly's 2024 priorities under the areas of housing and homelessness, and hope to bring that to the table. Not so sure about on Thursday at Rules Committee, but probably in January when we have that probably lengthier session to talk about the 2024 priorities. So look forward to that discussion. And then take it back to the 2024 committee agenda topics. So I just wanted to open up to see what topics that folks are keenly interested in tackling in 2024. As a reminder, this was some while ago, but I did share some agenda topics through April with the body. So I did share some framework of ideas. But if there are other things that folks want us to continue exploring, or new topics that folks want us to explore in 2024, now would be the opportunity to let me know as I develop the calendar for the coming year. I do know that member Brawley had herself in the queue for this, and if other members want to talk about this, that's great.
Yeah, thanks, Mr. Chair. So just briefly, I think all of the topics you already have are certainly relevant and discussion today. The other one I want to mention, well, I guess two. One is, we've talked about incorporating the work of the Housing Action Plan into various committees. I know Community and Economic Development Committee is going to be handling and is already handling a lot of the issues around zoning and kind of the land use broad category. And then this committee, I think, is really well positioned to deal with some of the other issues around housing affordability, working with landlords. Anyway, so just to generally mention, I hope we can continue those into next year through this committee to the extent possible. And then the other one I just want to mention, we heard months ago about the Forest Park mobile home court, and I mean the one in Turnagain, not the one in Eagle River, although that's certainly an issue. That they had a major rent increase, and they have a second one planned for January 1st. I also have recently heard Diamond Estates, which is in my district, but right on the edge of Midtown and West. About 1,000 folks living there. I believe many of them renting their trailers. They are also looking at $100 a month increase, and that property has changed hands. So I just wanted to state that in this meeting now, but also to note that the issue of mobile home parks especially is going to continue to be an issue. There's a lot of different ones there, but I'm really concerned about folks losing their housing, especially with these rent increases and the parks changing ownership, which we don't have control over, but this is a trend. So I just wanted to flag that as something that I think this committee should continue to track. I think we all have parks in our districts, and that's something I'm interested in as well. Thanks.
Great, thank you. Member Cross?
Yeah, I just wanted to add to Anna's comment. One of the frustrating things that's happened in the last several years, and this is in commercial lending, under debt service coverage ratio loans, which are used in commercial finance, if the property doesn't meet a certain algorithm, the lender will actually require rents to be increased. So when I see that it's changed hands and then they had to do a significant increase, that actually may have been a bank or lender requirement, which is why, some of what we can do to help prevent that is, I don't know if we work with Alaska Housing, whatever it is, to offer, better lending terms, but it needs to meet a specific 1.35. And if it doesn't, the lender will condition the loan on it being up to rents within 6 months or whatever that is. And so, maybe we won't go into a lot of detail that here, but it's a frustrating thing that happens from the real estate side, that the lenders actually mandate rent increases. Otherwise they won't do the loan. So just something for us to investigate. Thank you.
Great. Yeah, thanks for those insights. All right. Any other discussion on this before we move on? All right, not seeing anyone, then we'll go ahead and move on. Before I do our final agenda topic, I just want to do a brief, this is going to be difficult for the couple of folks on the phone, but if you're not on the phone, if you can, and if you're a member of the public, if you can do a show of hands, so if you can raise your hand on Teams if you're interested in participating in audience participation. All right, so I just see one individual. Okay, so then I'll probably budget time for 2 folks just in case. All right, so then our next agenda topic is an introduction to coordinated funding discussion. So this is a pretty hot topic right now, especially since Houston came up and emphasized the need for coordinated funding. We have some folks here today who will begin to be speaking to this topic and introducing the work that we are doing here in Anchorage. And we'll have more in-depth discussion in the new year on this topic. So with that, I'll turn it over to the partners.
Thank you. This is Karma Reed, and I am the Anchorage HUD Field Office Director for Community Planning and Development. And I'm here to give you a briefing on a group of funders that have come together over the last couple of months, including the municipality of Anchorage and the Assembly. We've just started meeting, although these parties are not new to collaboration. There have been efforts in the past, successful efforts to collaborate, and some of the results of those were presented to you today, which was really exciting to see. The complex care facility, for example, was an effort that came to be from collaborative funding. But right now is a time that various funders thought it was ripe to kind of readdress this and pull funders together and have another conversation. So that's what we did beginning in August. And so I'm just going to tell you really briefly what we've done so far. The entities that came together in August are listed here. The U.S. Department of Housing and Urban Development, that was me. The Municipality of Anchorage, primarily the Health Department and the Assembly. Alaska Housing Finance Corporation was represented, both the public housing arena and the planning department that does a lot of their grants. The state of Alaska, with a couple of different departments, were there, Rasmussen Foundation and the Anchorage Coalition to End Homelessness. And then we had a few meetings, and in December, additional funders came to meet with us, and that is when we heard from the city of Houston, which was great. So let me just tell you a little briefly what we have done
Actually,
so
Karma,
far.
if I can interrupt you really quick.
Yes, please.
So just in case my colleagues are wondering who from the Assembly went, that was me. I was there from the Assembly, and then with her coalition hat on, Meg Zalatel was there. So not her Assembly hat, her coalition hat. And then I just need to do a motion or request a motion to extend for 15 minutes, please. If a member could do that.
So moved. So moved. This is
Okay.
Anna.
Thanks. Thank you. Is there any opposition to the motion to extend to 12:45? Okay, hearing none, then we're extended. Go ahead.
Excellent. Thank you so much. So in our August meeting, we heard from Katie Miller, who is on the phone with us today as well, from the U.S. Department of Housing, U.S. Interagency Council on Homelessness. And she spoke to the wide variety of ways that coordinated funding can happen, the pros and cons. And then we had a lot of discussion about what individual agencies that were there had thought in terms of their pros and cons. And there was, quite frankly, fears about losing control, about trusting one another, about the time and effort it takes for planning and transparency, and the complications, the fears that their funders would they lose control over their ability to please their funders and fulfill their contractual relationships. But there was also a lot of excitement and recognition of the benefits that collaborative funding can offer in terms of transparency and really being strategic about investments and the benefits that can come to play when different funders actually have the same goal in mind. Although it might mean not funding one effort, it would mean more efficiently funding another. So that was a really good first meeting and discussion. Our second meeting in September, there was some momentum around these three areas: sharing information. There was some sharing of information at that meeting in terms of upcoming funding announcements, et cetera. And we thought this would be a good way to kind of build relationships and actually provide some benefits to the community if we could compile information about funding for in the future. And then also a thought about doing a pilot project where a few funders could come together and jointly offer funds, either competitively or otherwise, to fund a project together. It kind of sounds like the next step initiative, maybe doing this in some ways, and there could be other funding sources that end up coordinating with that project, although that's not something that came up in that September meeting. It was premature at that point. And then research. So one of the pieces in particular that came about was, can we map out what a project funding needs are for example, a supportive housing project for people with complex needs, and then have that as a template pro forma or something that we can work with in the future, both for providers and for funders and developers to piece together a project that can work. And then finally, we had a meeting in December where the main event was having the city of Houston come and talk about what went into their successes with collaboration, their continued challenges with collaboration. I'm not going to underplay that. It's hard work to collaborate and to continuously try to corral entities that have independent policymaking roles and responsibilities to really continue to focus on a common goal. And in their experience, it really required and benefited from a champion. And in the beginning, that champion was not a political person. It was, I think, in the beginning, it was more philanthropy. And there was a little bit of a hammer involved, but there was either a political, a philanthropic, or a business individual or body that was really the champion that kept bringing people to the table, kept asking the hard questions. And I think that was something that was pretty interesting for people to hear. And then we talked a little bit about potential future efforts to include a combined list of upcoming funding opportunities and possible coordinated funding for the next steps housing surge, although we didn't have a lot of time to get into that yet. So that might be a future piece of this, but that is all I have. We don't have another meeting set, although there is still interest in continuing to meet. There's a question in my mind about who the champion for this group is going forward. And I'll just leave that at that. And I have Katie Miller, who is with the U.S. Interagency Council on Homelessness, with us as well, who is going to give a few words.
Great, thanks, Karma. Can you hear me okay?
Yes.
Yes. Great. I just wanted to introduce myself. I've met some of you and I haven't met all of you. I want to make sure you're aware of what the U.S. Interagency Council on Homelessness does, just briefly, and make sure you're aware that I am a resource for you ongoing. U.S. Interagency Council on Homelessness coordinates the federal response to homelessness across 19 federal agencies at the cabinet level in Washington, D.C. There are 6 of us that live outside of Washington, D.C., and we work directly with communities to bridge what's happening at the policy level in Washington with what's happening on the ground. And I'm one of those people. I'm your senior regional advisor. I'm based in Seattle, and I have been working with Alaska for a number of years, and I'm really very closely with Karma and Michelle, and recently was there, and we talked about coordinated funding, and so I wanted to give that context. Next slide. So I work across the country, and coordinated funding is a key tool that communities use in order to really be able to maximize and bring mainly to bring new resources to the table. And so making sure you're fully using all of your federal, state, and local resources, but also offering a key place for philanthropy to fit in. And so we have seen in communities where coordinated funding plays out, that it really creates that clear transparency, goals, it aligns timing and forms and processes and priorities, uses data to drive investment, and and then leverages new resources. What we hear from communities that is sort of the key driver to this level of coordination is that funders feel like sometimes they're funding either the same thing or they're fully funding projects or not funding projects. They'll have projects that need to open their doors, but they don't have the full package of resources needed. And if they could just align their resources better, they could fund projects for what they need to be funded and in the timing that they need to be funded, and so that units can come on much quicker. And to fund a part of a project and not allow it to come online in time is really a missed opportunity for a community. Next slide. So there are ways that communities can collaborate on funding, and these are some of those examples. I think the biggest message is that it doesn't have to be perfect. Sometimes it's just about making sure that everybody is aware of what the other is doing. I have known many private funders that really don't want to come to the table because they're not clear what investments are being made locally and where they can make the biggest impact. They know that they don't have the same amount of resources maybe to fully fund projects, but they want to make an impact and align. And I think it was a comment was made earlier about making sure that everybody is traveling on the same highway and in the same direction. This is a clear way to make sure that progress is being driven towards a common goal. And I'll just say that combined funding or collaborative funding can happen. It can happen in small ways or big ways, and it can change over time. So once a group commits to this level of coordination, it can change and members can change, and it can happen through pilots or through at different periods of time. So just hope you all will consider that as a resource and a tool to really get resources and units online quickly. Next slide. These are just some examples of successful public-private partnerships that we've seen around the country. Each of them have websites and information. There are many examples around the country, but these are some that I thought I would highlight. Great. Thanks for letting me join you today.
And
Good afternoon.
Next we have Michelle Brown. Go ahead.
Thank you, Karma. Good afternoon, everyone. I'm Michelle Brown, a senior fellow at the Rasmussen Foundation. And Mr. Chair, I will shorten what I was going to say to try to get you out at the 12:45 level. We've heard a lot today about collaboration. We've seen the progress that collaboration has brought. The next horizon for us is funders also need to collaborate. Funders and providers are two sides of the same coin. They have different processes, different requirements, but they share the same desired outcomes, and both are absolutely needed to achieve those outcomes. So just as we ask providers to collaborate, coordinate, and align, we should also be asking funders to consider doing that with their respective resources. So when funders actually can coordinate to the extent they are able to with their funding sources, we can better ensure that all the pieces that are needed to implement Anchored Home or whatever sub-piece is being implemented are fully and adequately funded, rather than have these siloed grant processes that end up with some things underfunded and they can't go forward, or some even inadvertently overfunded because they write better grant applications. So this group was formed to help see if we could do some sort of alignment with everyone's respective relevant resources so that we could make implementing Anchored Home more efficient, more effective, and less burdensome to all the players, which then frees up more time to actually do the work. So specifically from the private philanthropy, perspective, philanthropy never has enough money to fully fund anything. But what makes philanthropy fine projects very attractive is when there are things that are co-funded by public-private partnerships and fully vetted by other funders. It enables them to be able to not have to do a whole lot of independent analysis and research, but to plug in and see the immediate value that they are leveraging by joining in to these kind of co-funded activities. The proof of concept of that was what happened when we collectively launched the public-private partnership for the recent additions to the system, Third Avenue, Complex Care, and the 3 hotels converted to housing. When people see that kind of cohesive plan and co-funding, they are more able to invest and regenerate actually more funds. So I just want to close by saying really appreciate the Mr. Chair, your participation in helping this group vet out its issues. Appreciate AHD being at that table and participating. We heard very loud and clear from Houston that this kind of collaborative funding and championship by private, either business or philanthropy, made a major impact in why they are where they are. So we're happy to brief you further in the future and appreciate your support. And
Great.
that's it for our presentation.
Great. Thanks so much for that presentation. And Karma, could you do me a favor and can you stop sharing your screen, please? Great. Thanks so much. So yeah, I think as I alluded to earlier, we'll probably hear more a little bit about coordinated funding and get an update on a lot of the work that working group is doing when we get closer to the first quarter budget revisions in April. I think we're planning on coming back and having a more in-depth discussion. But I think, as Michelle said, really what made Houston successful is the increased level of coordination. We have great coordination happening within the municipality right now, but this is taking coordination to a different level, and looking forward to engaging in that. Okay, so with that, Mr. Oliva, I think you were the only person who said you wanted to participate. So we're going to go ahead and Travis, if you can put the timer on, I'll turn it to you, Mr. Oliva. So if you can unmute yourself.
Can you hear
I can
me,
hear
Felix?
you. Welcome.
Okay. Do you want to see me? Not necessarily, but good morning. I'm Ron Oliva. I'm a property owner next to the Brother Francis Shelter. I offered my property for sale. It's been vetted by Agnew Beck and would like to either have you buy it, lease it, or I'm putting together financing in a group, and including multiple players, sell the tent to me, the big tent. I'll put it up on my property. I think the crown jewel has been stated that it is the navigation center. I think the closer we can put a controllable number of homeless near the navigation, whether it's through a sanctioned camp with pellet homes, with modulars, a warming station, the closer you can get them to those services, the better. The Houston model, I went to all the meetings, whether it was a warming shelter or for them in the summer, a cooling shelter. The navigation center is the crown jewel. And that was a great report by Dave Rittenberg. We do have good communications with Dave. As far as the good neighbor policy, it does need some polish and work, but I think we can make it work. The other thing is missing in the housing first situation with the homeless is putting them to work. And I'm working with Habitat for Humanity to convert my lot into a big sales donation lot. And then a training center, like for bike repair, and bring all donated bicycle, bike parts, things that are getting stolen in the city, you might as well get the homeless to come and repair them, make the parts available, and then they won't go out and steal it. The same with copper. Donate all your wire, have a wire stripping processing for recycling. And well, you're at the, I think it's now called the emergency cold weather shelter, which is the transfer station. But again, I'm pushing the repurposing of dumpsters into upstairs, working with a professor from the University of Texas who's lived in one for a year. So there's all kinds of good ideas. I can't beat you, so I got to join you. And you know, I've suffered, but now I'm trying to recover. And my goal is never to hurt the homeless, but to help them. And I think by what Michelle pointed out, a collaborative effort, both private and public funds, that location can be used successfully as a campus for the homelessness, transitioning them out to independent living and welcoming back as productive members of society. I thank you. 3 minutes. Voila. Any
Great,
questions?
thank you, Mr. Oliva. I do not see any questions, and in fact, we are actually out of time. So thanks, everyone. Have a happy holidays, happy new year. We will see you in 2024. With that, I will adjourn this meeting.